Glad you could join us again for another Facebook Friday. I'm Dr. Alan Van Scoik, and once again I'm joined by Dr. Mina Potros, and we are here again in the Glendale office. It is a beautiful Friday, and we are excited to be back with you. Why are we excited to be back with you? This is the third time that we have done this. Unfortunately, we had some audio issues, and so now we get to do it one last time. So kick back, grab your dinner, and we're going to talk to you about a great topic. So this weekend is Father's Day. So what I wanted to do is I wanted to go through a couple of men's health topics. More specifically, some of the leading causes of what unfortunately kills most men and some things that we can do to help that out. So I went and compiled the top 8 reasons that unfortunately men pass away, and I'm going to give that list to you now. So number 1, unfortunately, is heart disease. This is once again a pretty common one that most people know, and we'll talk a little bit about ways that we can help that out in just a minute. Number 2, cancer. Number 3 is an interesting one. It's actually preventable accidents. Number 3 killer of men. Number 4 is chronic respiratory issues, lung problems, lung disease. Number 5 is strokes. Getting back to the cardiovascular issues, strokes, number 5. Number 6, we're looking at dementia and mental disease. This is a big one for a lot of people that doesn't get talked about, but number 6 killer, very, very important for us to talk about in a minute. Number 7, diabetes. Number 8, suicide. These are all the top 8 compiled. Once again, some of them were a bit of a surprise to me. Some of them were a little bit of what I had expected. First one, once again, cardiovascular disease. We know about cardiovascular disease, and we know that this has been an issue for both men and women for a very long time. Much research has been done. Many people have looked at how are we able to help combat cardiovascular disease. So when they talk about that, what do you think is the highest rated way to help combat cardiovascular disease?
I would assume it's movement and exercise.
Exercise, really important for us, absolutely. Top 2 that they talk about, exercise and diet, really important. This is a big topic for us inside the office right now with COVID, having people staying at home. They haven't been out getting exercise. They haven't been doing the movements that they're used to be doing. And so unfortunately, there's most likely going to be an uptick in some of the cardiovascular issues. Now it's already number 1, so this is really important for us to get out and move more. In fact, a study out there showed that in 2018, National Institute of Health did a study that showed 57.6% of all men don't reach the recommended limits of activity. I mean, that's a huge number of people that are not getting the amount of exercise that they need to be getting. Huge number. And this is 2018. This is before all the COVID issues kicked into play. And now that we're sedentary, staying at home, we really have to be vigilant in combating that. Number 2, cancer. Now, once again, there's all sorts of different cancers. Because we're talking about men's health, there's a couple type of cancers that are more important in men and more recognized with men. Dr. Potros, give us some ideas on cancer for men.
So one of the more common one that we see among men is prostate cancer. Now that one is, I always preach, it's a really treatable one if you catch it early. Okay. Now, if you catch it early, the success rate of treating it and having a healthy life after that is actually quite high. And if it's not caught early, unfortunately, it can actually spread to different areas, and then it can become a lot harder to treat. And this is something that we see as we get older, that it becomes more and more problematic and increases our risk of getting this prostate cancer. Now, there's a few things that you can pay attention to make sure, hey, am I at risk? Is this maybe affecting me? Should I get it checked out? First thing, of course, is we want to make sure we're constantly getting our prostate exams after we reach a certain age, according with your medical doctor. The second thing you want to make sure is you want to make sure there isn't any changes in your ability to hold urine, or if you're going to the bathroom more frequently and you just feel like you can't empty your bladder. Any changes like that is usually a good sign telling you, hey, there's something going on there. Perhaps it's a good idea to get it checked out. And the third thing that might be interesting is one of the signs that you might notice if you are, developing prostate cancer is you might actually have low back or even hip pain. And so as chiropractors here at Chiropractic Company, it's something that we're trained and paying really close attention to make sure, hey, what's causing your low back pain? What's causing your hip pain? Is it from the nervous system? Is it, muscles? Is it a strain, a sprain, a joint issue? Or is it something more serious where we have to refer you out to a medical doctor?
These are all really important things. Once again, prostate is a very important one for us to evaluate and to continue to monitor as we age. Some studies show that you should be getting it checked out at 40, some say 45, but most people say 50 is the year that you should be starting to get pretty regular prostate exams. So we really want to make sure that that's functioning properly. And unfortunately, it's right. A lot of the symptoms can manifest itself as far as low back pain. So we want to make sure that not only if you have low back pain, that that's being evaluated, if you have some of those other symptoms as well. Number 3 for us, once again, is preventable accidents. So this weekend, there's a lot of weekend warriors that are going to be out there working around the house. Know that the number 3 killer of men is preventable accidents. So take your time, look at your surroundings, make sure you're doing things the right way. Don't get sloppy, don't cut corners, make sure you're safe out there with all the projects that you're doing over the weekend. Number 4, chronic lower respiratory diseases, or once again, lung disease in general. Now, this was one that I expected to be a little bit higher over the past years. This was a big part of the media push to make sure that patients and population in general is well taken care of as far as their lungs are concerned. There's a lot of money put out there in regards to getting information about smoking and some of the dangers and problems with smoking. Now that COVID has come around, once again, that's been back in the limelight again because of all the respiratory issues that seem to go along with getting COVID issues. So lung functionality is really important. Now, there was a study out there that showed that smoking among males is still at 16%. I found that to be very high. With all the information out there about how bad smoking really is, still 16% of us still smoke. So if there's people out there, we really need to work hard on making sure that there's prevention of smoking. We know how difficult it is to stop smoking once you do smoke, so really prevention is the key. Good education out there, but if you have younger kids, try to talk with them early on. Don't get them hooked on it. Don't let them get hooked on it. Really very important to limit that statistic. Keep that one moving down the chart as much as possible. Number 5, stroke. Once again, when we get back into cardiovascular issues, we're looking at how well the arteries are functioning, how well the veins are functioning, how the blood flow is going through your body. If there's issues with inflammation, then there's chunks that'll break off and cause different issues. So we want to make sure cardiovascularly that you're very healthy. Once again, that gets back to exercise, that gets back to diet. Very important for you to be eating good, healthy foods, not pro-inflammatory foods. A couple ideas of pro-inflammatory foods: refined sugars, refined carbohydrates. Most synthetic foods are highly pro-inflammatory. Do you have any anti-inflammatory foods that you like?
Yeah, so a really good anti-inflammatory food, one of my favorite, is something that you would cook with, and it's olive oil. So there's tons of studies that have shown that people around the Mediterranean region are using olive oil more abundantly, and they are much lower risks and have much better statistics than we do when it comes to strokes and cardiovascular diseases and even dementia and Alzheimer's.
That's huge, and that's fantastic. I personally love olive oil. I try to cook with it every opportunity I get. I love the taste of it. But that gets back to our number 6, which is dementia and mental disease. Now, this is a tough one because traditionally, growing up, there was always a stigma attached to mental disorders and that it wasn't very much talked about, and that it really wasn't something that people treated out in the open. Recently, there's been a bit of a change. People are now recognizing how important mental health really is, and it's being treated more of a traditional illness rather than something that needs to be hidden away. Mental disorders are much more prominent than people realize, and it covers all sorts of different spectrums. And so if we can manage those, once again, catch them early and treat them as we would any other disease, we'll go a long way with bringing that one down on our list as well. And that also includes, once again, kind of tying into number 8, which we'll get to in just a minute. However, number 7, killer for men, is diabetes. Now, this was a bit of a surprise to me. I figured that this one would be higher as well. Unfortunately, this one also typically falls into the diet and exercise. Now, there's a lot of different types of diabetes, and some need to be managed through insulin and through other medication. But there's many of them that if we can catch it early and you're pre-diabetic, we can start making good progress with, once again, diet and exercise. Now, we've said this for a couple different topics. Why is it that it's so hard for us to get on that diet and exercise train? Why is it so hard for us to get going? What do you think about that?
So there's, different reasons. One of them is going to be, and a really common one, is people, when they try to get into a healthy exercise program or regimen, they feel really achy, they have pain, they have stiffness, they're not flexible, they're unable to perform the way that they want to, and so it becomes very discouraging. And naturally, as human beings, we tend to shy away from things that are uncomfortable. So working out within itself, any kind of physical activity, is going to be a little bit more, demanding on the body than just laying around and relaxing. And so that alone creates a certain level of a hurdle. And then when you have to add another layer with pain and stiffness and aches and numbness, it really can get in the way of your ability to consistently work out and live an active, healthy lifestyle.
It becomes very demotivating when you have pain. Pain is exhausting, and when you're out there and you know that you're going to be doing something good for your body, but then it just gets you pain and sore and achy, it's very difficult to get over that hurdle, like Dr. Botros said. So there's a lot of different ways that you can do that. First off is recognize that it might be uncomfortable for you to start when you start working out. There's different sorenesses that your body's going to go through that might be okay for it, but there's others that might not be okay for it. And that's a big part of what chiropractors do, is that we assess those structures to make sure that they are healthy for you to be able to continue to exercise. So if you have questions or concerns about that, or have issues starting a program, let us know. A lot of my patients have been telling me that recently. They're saying, hey, I'm trying, but I'm just not getting to be where I need to. Can you help me out? And I go through an assessment with them and make sure that they're able to do the exercise that they want to do, or are doing it properly, or are capable of doing it. So we want to make sure that we're able to do those exercises and grow and get stronger overall. So use us as a resource if you have any kind of questions or concerns, because like I said, many of these top killers simply come down to exercise and diet. Now, the last one on our list, unfortunately, is suicide. And now, we talked a little bit about this when we did our Veterans Day Facebook Friday as well. We learned that every single day, 22 veterans are dying because of suicide every day. I mean, that's just an astronomical number. It's horrible. The more that I see that, I just am floored by it. So this is, once again, one of those issues that on a mental health thing, we need to continue to keep in the limelight. We need to continue to address on a regular basis. It is just not acceptable to have that number what it is. With COVID being what it is right now, a lot of people are not getting the interaction that they need. A lot of people are not getting the help that they need. They're letting that go by the wayside, and a lot of these issues are starting to increase, so we need to stop that. If you know of people that might have mental issues, are struggling through the COVID, reach out to them, contact them, call them, text them, email them, whatever you have to do. Try to get in contact with them to make sure that they're doing okay. There needs to be constant work on this, and it's not something that's easily done. But if we're vigilant about it with our friends, family, other people in our community, we can really bring that number down. Unfortunately, in males, under 45 years of age, suicide is actually number 2 on this list.
Unbelievable.
Number 2, cardiovascular issues, suicide. And that's incredible. There's so many other things out there, once again, that should be way higher on this list than suicide. This is one that we can work hard to prevent. So if you have concerns or questions, once again, so many great resources out there. We posted some last time as far as veterans are concerned. To reach out, if you need to contact someone, please call, please do it. And once again, for all of our friends and family that might be struggling out there, give them a call. It doesn't take much effort. Make sure to get in contact with them. So this is what we have as far as men's health going into the weekend. Now is a great opportunity for you to get outside, enjoy some of that beautiful weather. Hopefully it doesn't rain. It's been gorgeous out there the entire week. So hopefully you can get out there, be motivated to do more, get stronger, be more active. If you do have questions or concerns about your health and you want to get it checked out, let us know. Where would we get that checked out?
So you can Google chiropractic company, or you can go to chiropracticco.com. We're in the Glendale location, or they can give us a call or comment on the videos here.
And that's, the phone number in our office is 414-332-0859. We also had a question about stress levels, because there's 3 different stresses that really cause these issues. Once again, physical stress, chemical stress, and emotional stress. All 3 of these impact virtually every single one of these top 8. And if you can manage those stresses better, you're going to be healthier. Physical stress, get out there and exercise. Chemical stress, make sure you're eating healthy. Mental stress, make sure you're decompressing and finding opportunities to get rid of those stresses from job, finances, relationships, what have you. Once again, here in the chiropractic office, we do a great job at helping manage those stresses